And also, few of your names are different in the Google Meet. So I kindly request them to put their real name in the chat box at least so that we can count on them.
Namaste everyone. Respected panelists, for the judgment of today's scientific presentation and the core committee members of Tadvidya Sambhasha Parishat Trust presenting Tadvidya Sambhasha Parishat International Intellectual Conference 2026. I wholeheartedly welcome all the delegates who are our pride presenters for today's presentation for the round one of scientific paper presentation. So the event is starting in couple of minutes. As a welcome note, I am here before you to wish you all the best. Do your best and try to reserve your place for the second round of presentation over the stage during the event lively. Hope you all will do best and make difficult for the judges to judge your presentation and make them scratch their head to mark whom the best among you all. With this brief wish, I hand over to our organizing team, Dr. Jannavi, Dr. Harshita, and Dr. Jivita to lead the event. Thank you.
Thank you, sir. Harihi Om, Shri Gurubhyo Namaha. Om Namo Bhagavate Vasudevaya. Dhanvantaraye Amrita Kalashahastaya Sarvamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha. Namaste. On behalf of Tadvidya Sambhasha Parishat, I take the immense pleasure to welcome you all to the online paper presentation of Tadvidya Sambhasha Parishat 2026.
Tadvidya Sambhasha Parishat has over the years established itself as a distinguished academic forum, consistently fostering an environment that unites scholars, students, practitioners, and Ayurveda enthusiasts for meaningful intellectual exchange and scholarly deliberation. This year, our focus is on the journey that every practitioner must take: Patha, Avabodha, and Anusthana, the path to practice. We are here to explore how textual study transforms into a deep understanding and eventually into a successful clinical application. To guide and evaluate our session, we are honored to have an esteemed panel of judges, and it's my pleasure welcoming Dr. Savita Padashetti ma'am, Professor and Head, Department of Samhita Siddhanta, KAHER Shri BMK Ayurveda Medical College from Belagavi. We welcome you, ma'am.
Thank you.
And our second judge is Dr. Deepa Hallikeri ma'am, Associate Professor and Head, Department of Kriya Sharira, Member of BOS RJHS, Bangalore, MRM Ayurveda Medical College and Research Center, Bagalkot. We heartily welcome you, ma'am.
Thank you, ma'am.
And we have Dr. Pradeep Agnihotri sir, Professor, Department of Rashastra and Vaishajya Kalpana, Scientific Committee Member of Tadvidya Sambhasha Parishat from Ayurveda Mahavidyalaya Hubli and Hospital. We heartily welcome you, sir.
Thank you, thank you.
And a special welcome to Dr. Saurabh Kokatnoor sir, Managing Trustee of Tadvidya Sambhasha Parishad Trust. We heartily welcome you, sir. Now, to ensure that we stay on the schedule, here are the guidelines for our presenters. For the presentation, you have 5 minutes to present your paper, and 2 minutes will be given for discussion with the judges. And please stay muted unless it is your turn to speak and to avoid the background noise. And I request whoever is presenting, please switch your video on before presentation.
So let us begin the intellect.
Now let us begin the intellectual journey. I invite our first presenter, Dr. Lavanya. I request you to keep your video on, please. And please start once I say start, because I'll keep a watch on time. You'll be given 5 minutes.
Yes, ma'am. Am I audible?
Yeah, can you please be a bit louder?
Am I audible now? No?
Yeah, you are audible. Okay, you can start now.
Okay. Namaste all. Myself Dr. Lavanya. I'm from Sri College, Bangalore, final year PG scholar, Department of Samhita Siddhanta.
Your 5 minutes has been started, doctor.
Hello. Title, am I audible?
Yeah, you are audible. Please, I request you to be a bit louder.
Okay. Title of my presentation is Exploring the Therapeutic Relevance of Aushadha Marga through Nabhi Purana. Contents: introduction, review, case study, discussion, and conclusion. So aims and objective. Aim to analyze the role of Nabhi as Aushadha Marga through Nabhi Purana in Udavartini Yoni Vyapat. Objective is clinical trial was conducted amongst the 3 patients diagnosed with Udavartini Yoni Vyapat to prove the therapeutic efficacy of Nabhi as a Aushadha Marga. So materials and methods used is literally data was collected from Bharati and scientific journals, and also patients were collected who are diagnosed with primary dysmenorrhea, and appropriate scales used for the assessment of the pain, that is VAS scale and valid score was used. Introduction. The therapeutic success not only depends on the medicine but also on the Aushadha Marga, or the route of drug administration through which the medicine reaches the target site. The selection of an appropriate Aushadha Marga is based on the dosha, site of pathology, and ease of access. So Nabhi as a Aushadha Marga, when we see, we do have very scattered references and also very few references. So here an attempt has been made to prove Nabhi works as a Aushadha Marga. Next slide. Aushadha Marga. So quick action and target-oriented approach depends on the route in which the drug is administered, and the different routes of drug administration mentioned in the classics are with respect to the Bahirmukha Srutas, so majorly Mukha, Guda, Mutramarga, Yoni, and Nasa, Karna, Akshi, Twak, and Nabhi. So Nabhi as a Aushadha Marga. So when we see the references of Nabhi as a Aushadha Marga, so in Shruta, in Kalpasthana, in the 5th chapter, 8th shloka, it is mentioned that Vamshatvagadi Agada, which is used in Luta Visha. So when this Agada is applied over the Nabhi as a Nabhi Lepa, it helps in the relieving of Purisha, Mutra, Anila, and Garbha Sangha. And also, Shushruta has mentioned there are 24 damanis which arises from the Nabhi in Urdhva, Adha, and Tiryak Gati. It moves. And also, 2 of the damanis supplies the Garbhashaya. And also, other reference what we see is in Bhava Prakasha, in Atisara Chikitsa Adhikara, it is told that Nabhi Purana using Ardraka Swarasa, that is Ardraka Swarasa, which is being poured over the Nabhi. And also the Amlaki Kalka is used as a wall for constructing around the Nabhi, and the Ardraka Swarasa poured into it acts as a Arthika Chikitsa in case of Atisara. Next slide. So Udavartini Yoni Vyapat. The Udavartini Yoni Vyapat was chosen majorly because of predominance of Vata, and also amongst the Yoni Vyapat, Udavartini Yoni Vyapat is having the clinical features like painful menstruation, and also women feels reliefs immediately after the discharge of the menstrual blood. And when we see the pathology, we can see the Apanavata Dushti, which is leading to the pain. So when we see primary dysmenorrhea, again pain is a major complaint, and also there will be no further secondary pathologies involved in the primary dysmenorrhea. There will be only the symptoms of pain, and also associated symptoms like headache, nausea, vomiting, diarrhea can be seen. Next slide. So case study. So 3 patients who are diagnosed with primary dysmenorrhea was taken for the study, and then unmarried females also who are having the regular period cycle was chosen. And chief complaints included pain in the lower abdomen, low back, and legs during menstruation. No? And also one patient had associated symptoms like nausea, headache since 2 years.
Last 30 seconds.
Am I audible?
Yes, you are audible. You have last 30 seconds.
Okay, next slide. So method of intervention was that Erenda Taila was chosen for as a Vatahara line of treatment, and also Nabhi as a route of drug administration. And the classical method we do in case of Janu Basti, similar method was used, but the Basti was done around the Nabhi. Next slide. So valid score and VAS score was collected, and then before and after treatment treatment interpretation was done, and the significant pain decrease was seen. So discussion that therapeutic efficacy of any intervention is in Ayurveda is significantly influenced by the Aushadha Marga, as it determines the rapidity of action and also precision in reaching the target site. This supports the classical concept of Nabhi as a Aushadha Marga and also Vatahara action by the Taila. Next slide. So Nabhi Purana is a simple non-invasive effective therapy for managing Vata-dominant Udavartini Yoni Vyapat. It significantly reduces the pain, likely by normalizing the Apana Vata through the localized Nabhi route. Thank you.
Yes, thank you. The time taken is 5 minutes, 40 seconds. Now the panel is open for discussion.
Can you repeat me the time taken?
Ma'am, 5 minutes, 40 seconds, ma'am.
I have one question to the presenter.
Yes, ma'am.
Is she there?
Yes,
Dr. Lavanya, are you here?
Yes, ma'am.
Okay. How many cases you have seen this?
Ma'am, can you please repeat?
You have done in a case study, right? The same topic.
Yes, ma'am. 3 case studies, ma'am.
3 case studies.
Yes, ma'am.
What was the outcome you have seen in the patient?
There was a pain reduction, but statistically it was not shown as the patients were less number.
How many days you have given this treatment?
5 days treatment was done, no? And considering primary dysmenorrhea, which starts 48 hours before the regulation of beginning of menstruation, so 2 days prior and first 3 days of menstruation, total 5 days the treatment was done.
Is there any direct reference related to this treatment anywhere in Samhita?
Ma'am, there is no, for in case of Udavartini Univapat, there is no direct reference, but to prove Nabhi as Aushadha Marga, this was being chosen, and also as a Vatahara Kriya, which is required in case of Udavartini.
Do you have any validation related how many days you are supposed to give this treatment?
Ma'am, actually considering 5 to 7 days of menstrual period, and also 2 days priorly usually the pain starts in case of primary dysmenorrhea. So considering that, the days were chosen.
You have taken 5 days, right? You have done this treatment for 5 days?
Yes, ma'am.
5 days. Done from my side. Thank you.
Madam, I'm not having any doubt. You can carry next one.
Okay, ma'am. Okay, ma'am. Okay, our next participant is Dr. Abha D. Sagar.
Hello, am I audible?
Yes, doctor, you're audible.
And your
time.
Yeah.
Please keep your video on.
Yes. Are you able to see me?
Yes.
Okay, great.
Okay, your time starts now.
Okay, good evening to everybody present here. I will be presenting, I am Abhadi Sagar, an intern in Athreya Ayurvedic Medical College, Bangalore. I will be presenting a single case study of successful management of Dushta Vrana with special reference to varicose ulcer. Next slide, please. A 62-year-old female who's a farmer by occupation consulted at GAD Nelamangala on 5th of January, presenting with a complaint of non-healing wound over the ankle region of right leg since 5 months. And she also complained of swelling, severe pain and watery discharge from the wound. Next slide, please. The patient presents history of the present complaint. The patient presents with an ulcer in the ankle region of right leg since 5 months, which occurred spontaneously. It was gradual in onset and progressive in nature. There was no history of trauma. She consulted allopathic hospital and also practiced folklore medicines, which gave her no relief. She also has history of varicose veins since 15 years. Past history, no history of similar illness in the past, no history of hypertension, diabetes, tuberculosis, or any other systemic diseases, or no history of any previous surgeries. The medication she took for this condition earlier was autolyzed ointment and hyphenac tablet. General examination, appearance moderately nourished, height is 160 centimeters, weight is 70 kgs, hair, skin are normal, icterus pallor cyanosis was absent, edema was pitting type. Local on all the general systemic examination, no abnormalities were found. On local examination, during inspection, the site was medial over the medial malleolus. Number was single and solitary. Size was 2 by 2 in centimeter. Shape was circular. Margins was irregular and sloping margin. Floor was red, with unhealthy granulation tissues and slough. Discharge was serous, and the surrounding area was hyperpigmented, and there was localized swelling seen on the anteromedial aspect of the right lower leg. On palpation, tenderness was positive, edges were sloping and irregular margin. There was no induration in the base. Depth was around 4 to 5 mm. No bleeding on touch was seen. Not fixed to the deeper structures. Pitting edema was seen over the hyperpigmented area. Now, in differential diagnosis, we consider diabetic foot ulcer, arterial ulcer, and venous ulcers. So, ruling out diabetic foot ulcer because she was not diabetic in nature, and the location was not over the sole region, and it was not surrounded by callus. And in arterial ulcer, it was ruled out because the arterial ulcers are generally dry and scaly, and they have severe pain which increases on elevation, whereas varicose ulcer was exudative, and it was a wet ulcer with slopy edges, and it was relieved. The pain was relieved on elevation. So the final diagnosis was venous or varicose ulcer and Dushta Vrana. Now, the treatment we gave was cap viscovas, cap grab, and Triphala Gugulu tablets. And we also advised treatment which was Vrana Prakshalana with Panchavalkala Kvata, and wound dressing, which we did using WH5 ointment and Jatyadi Thaila. Now, the results were seen here. On 5th, when she consulted, on 5th of January when she consulted, that was the condition, as you can see in the picture. After 10 days of treatment, on the 16th, we again captured the photo of the condition of her leg, and we could see a very good improvement. And on the 31st, which was almost the last day of her treatment, we captured this picture, which showed the wound was closed completely. Discussion. Internal medications were focused mainly on elevating Pitta and Rakta doshas. Local therapies like Vrana Prakshalana and Bandhana were anti-inflammatory, antimicrobial, and wound healing in actions. Now, to look into the mode of actions of internal medications, Cap Viscovas, which contained Gugulu, Manjishta, Shigru, Pippali, etc., which it reduced endothelial damage, improves overall blood circulation, and balances Pitta and Rakta. Cap Grab promotes wound healing, which is Vrana Ropana, blood purifier, anti-inflammatory, and antimicrobial properties it has. Next is TAP Triphala Gugulu, which promotes collagen formation and tissue regeneration. It also helps in healing of chronic infected and non-healing wounds, which are nothing but Dushta Vrana. Now, WH5 ointment, it has contents like aloe vera, haridra, karanja, etc., which addresses the inflammatory conditions, helps in reducing redness and swellings, promote faster healing of the ulcers or wounds. Jatyadi Thaila, as very well known for Vrana Ropana, Krimigna, and Shotahara, it balances Pitta and Kapha doshas. It also looks into hemostatic and tissue regeneration. Now, the action of the local therapy, which was Vrana Prakshalana, we used Panchavalkala Kvata, which is predominantly having Tikta and Kashaya Rasa. So the Kvata helped, when we poured the Kvata, it helped in increasing the local circulation of the blood, and it also did Vrana Shodhana and Kledahara, which reduced the debridement of slough and exudates. Next, on conclusion, Dushta Vrana is a chronic infected non-healing wound or ulcer. An immediate attention or antiseptic precaution must be taken to prevent its further progression. The observation was it promoted wound healing, relief from the symptoms, and improvement of quality of life of patient. And on a conclusion, I would like to say that Ayurveda has once again proven to be one of the best systems to attend to such conditions. Thank you.
The time taken is 5 minutes 35 seconds. Now the panel is open for discussion.
Abha, it's a good presentation. I want to know how that you know about the drugs. What is that in the grab that is helping in a wound healing?
Yes, sir. So firstly, to answer your question as to how I know the usage of these drugs, I have seen the practice of this drug in my hospital, first thing. I learned it during my internship in my hospital. And secondly...
I understand. What is that particular ingredient in the grab that is helping a lot?
Yes, sir. So the contents of this grab is, it has Vranapahari Rasa, which is made of Parada, Manashila, Haratala, and it also has Triphala Gugulu in it, Arogya Vardhini Vati, Gandhaka Rasayana in it, and more such contents which act as Rakta Shodhaka. It is anti-inflammatory in action, and it is also helps in Vranapahari Rasa. It is a natural wound healing agent. So all of these put together gives a very efficient way of giving a wound healing.
Dr. Abha,
Yes, ma'am.
Did you give any suggestion related to Patya to the patient?
She belongs to a rural area and she eats only ragi mudde type of food. She's not a non-vegetarian. So I asked her to continue with her regular diet, but I also advised her to, start usage of stockings and regular walking and elevation of the leg at least for some time in the day. Apart from that, we didn't suggest her any much change in the diet because already her diet was very mild and very basic South Indian Karnataka food, and they were very difficult to even to adapt to the treatments we were asking her to do. So we didn't stress her so much about the diet she should follow, or because it is a very remote area and there's no reachability. So that's why we just asked her to get a stocking for herself and do the walking and elevation part, and we also advised her to apply pinda thaila on the externally.
Which desha she belongs to?
Sorry.
Which desha?
I would.
Jangala Sadharana, which desha she belongs to mainly?
Ma'am, I'm thinking she belongs to Jangala Pradesha, which is
not thinking. No. She might have told from which place she belongs to, right?
She belongs to Nelamangala, a rural area in Nelamangala, like outskirts of Nelamangala.
So you should be knowing the climatical changes or the climatical things in the Nelamangala. Because might be because whatever you are taking a history, Desha also plays a very important role. Patya also you are giving, or any type of the other recommendation you are giving to patient. Because in Ayurveda, Desha also plays a very important role in consideration of taking history as well as giving a treatment also.
Yes, ma'am.
Yes?
Yes, ma'am.
Okay, whenever you take a case history of any patient, just keep in mind that which desha she belongs to or he belongs to. That must be known by a practitioner.
Yes, ma'am.
Because that also plays a role. Do you think yes or no?
Yes, ma'am, definitely.
Healing and non-healing also somewhere it also plays an important role related to desha.
Yes, ma'am. I totally agree.
I hope you understood.
Yes, ma'am.
Right? Okay.
Yes,
Thank you.
Thank you, ma'am.
Okay, thank you, Dr. Abha.
Thank you.
Next, we have our next participant, Dr. Aishwarya Guddadamani.
Yes, ma'am.
Okay.
Good
Are you
evening,
ready, Doctor?
Yes.
Okay, your time starts now.
Good evening, everyone. I'm Dr. Aishwarya Guddadamani, first degree scholar, RSBK, from Ayurveda Mahavidyalaya, Hubli. The title is Role of Shivagutika and Prameha. So, according to mythology, Lord Shiva was afflicted with Prameha due to its dietary habits and sedentary lifestyle. It was Lord Shiva who gave this remedy known as Shivagutika. Prameha is metabolic and lifestyle disorder which is more prevalent in this period. Prameha is one of the rapidly growing global diseases. Controlling blood sugar level is a primary task of diabetes, which is only possible through proper diet, medicine, and lifestyle in today's scenario. Prameha prevention protocol includes the Agnihotri and therapy. So diabetes is a warning for India right now. India
Presenter, kindly check your network. It's fluctuating. Sorry for disturbing.
Yeah.
Please check your network. Your timer has been stopped.
Ma'am?
Yes.
Shall I start? Diabetes is a warning for India. India is second number of diabetic globally, followed by China. The number of adults with diabetes is expected to rise by 134 million by 2045. If these diabetic patients is inadequate treatment, develops medical complication leading to diabetic retinopathy, diabetic nephropathy, diabetic neuropathy, and various health problems, even leading to death. The main objective is to study the role of Shivagutika in the management of Prameha, to understand the Ayurvedic concept of Prameha, and to analyze the clinical action of Shivagutika and Prameha. So the root cause of diseases. In Ayurveda, such condition explains Samhita under the heading of Charaka states that Asasukam, Sapasukam, Viddhagni Anuparasa. These are factors of kapha leading to Prameha. Ayurveda describes Prameha as metabolic disorders characterized by Mutra and Avilamutrata. In contemporary understanding, this is correlated with diabetic mellitus. WHO have classified diabetic into type 1 and type 2, insulin dependent and insulin dependent. So action of Shivagutika. Shivagutika is mentioned in these classic for metabolic disorders. Shivagutika is unique and popular formulation in which the Shilajit is an ingredient of Shivagutika. Shilajit is having a multicentric action which corrects the Tripdosha. Shivagutika is one among the Ayurveda formulation known for the Rasayana. Same as Shilajit. Shilajit undergoes a series of Ayurvedic procedure to enhance the potency of the drug. So it contains herbal mineral ingredient which reduces the kapha, medadhatu, and corrects the metabolic function. Shilajit, which is known for the broad spectrum therapeutic properties, and addition empathizes with the management of Prameha.
Excuse me, doctor. Please check for your connection. I've stopped your timer, but please check for your connection.
Yes, ma'am. Hello. Hello.
Yes, you're audible now, and I'm resuming your timer.
Yes, ma'am. Shilajit is accounting for the action of Deepana, Pachana, Vata, and Lomana, and Lekhana effect to reduce the Medohara properties. Next. So discussion. This medicine was prescribed to Lord Shiva to Lord Ganesha for treatment of Prameha. Prameha is mainly due to kapha, meda, mamsa, kleda imbalance. Shivagutika is versatile polyherbal drug containing ingredient which corrects Agni and metabolism. The person using this medicine for the 1 year without break can continue to live up to 200 years. The conclusion. According to Ratnavali, describing this Shivagutika is capable to remove all kinds of diseases. Shivagutika is well trusted Ayurvedic formulation and for its uses and benefits in promoting overall health, used for varieties of conditions right from respiratory health to digestion, immunity, and reflecting its versatility. Understanding these principles provide a holistic insight into formulation, mechanism of action, and its wide range in therapeutic application. So these are the references I've used. Thank you.
Thank you. Ma'am, the time taken is 3 minutes 55 seconds.
Dr. Aishwarya, can you
Yes,
tell
ma'am.
me what is your topic?
Role of Shivagutika and Prameha.
In which type of Prameha you are using the Shivagutika?
Stula Prameha.
My question is because in Charaka Samhita they have been already told many types of Prameha. So whether you wanted to give in those types of Prameha or general Samanya Prameha or specifically wanted to take?
This can be used for Samanya also, ma'am.
Is it a trial one or it is just you are given to any patient? Shivagutika?
Ma'am, I've seen, the person I have not prescribed, but I've seen people giving Shivagutika and Prameha.
You have seen patient taking the Shivagutika?
Yes, ma'am.
But whether you have taken a history of that patient, one who was taking this medicine?
Yes, ma'am.
So what type of the Prameha he was suffering with? Because unless and until who doesn't know the content of ingredients of Shivagutika, you cannot prescribe it to any type of Prameha. That's my question is, in which type of Prameha you saw that Shivagutika is being given to? patient?
Like suffering from Prameha from last 2-3 years now.
See, what is your case title is?
A role of Shivagutika and Prameha.
Role of Shivagutika and Prameha.
Yes.
So this is not the case you have taken and you are presenting. It is just your observation and you are telling it.
Yes.
So what you have observed in that patient, when you are giving Shivagutika, what type of Prameha he was suffering with?
Like my general Prameha.
Because in your presentation, there is one point which to be judged, depth of the knowledge of the content. So when you are using the Shivagutika and Prameha, what type of action it does? In which type of Prameha it does the action? Because you have taken a reference from Charaka Samhita, right? Your first reference is Charaka Samhita.
Yes, ma'am. Ma'am, this Shivagutika does Lekhana and Veda and act as the Saina in Prameha.
Because you belong to Rashastra department, right?
Yes, ma'am.
You should be having a very depth knowledge related to medicines, because you all are the best practitioners.
And how many patients you have observed, ma'am?
Not much, ma'am. 2-3 patients I have seen.
2 to 3 patients.
So that 2 to 3 patients will give you
observed? What changes you have observed after prescribing Shivagutika in that patient?
Wow. Ma'am, I'm sorry, ma'am. It's not.
Okay, okay. Before presentation, you should have little thorough knowledge about that. Okay, it will be helpful for your presentation better presentation. You should have depth knowledge regarding that. Okay.
Then from our side, Dr. Harshita.
Okay, ma'am. Thank you, Dr. Aishwarya. And our next participant is Dr. Vaibhavi S. Iramat.
Yes, ma'am.
Okay. Okay, doctor, your time starts now.
Shri Gurubhyo Namaha. Good evening to everyone. Myself, Dr. Vaibhavi Hiramat, under final PG scholar from PG Department of Panchakarma, under the guidance of Dr. I.B. Kottashetty sir. And today my topic is clinical intervention of a folklore formulation, Sutakada Kuttike Vati in Kashtartava. Next slide. Introduction. Dysmenorrhea is becoming the today's burning problem throughout the world, and which causes the discomfort for women in day-to-day life activities. And according to WHO, the dysmenorrhea refers to the pain or discomfort associated with the menstruation. So the purpose of the study is to evaluate the efficacy of Sutakada Kuttige Vati in Kashtartava, and it is a handwritten document, and it has been used by my grandfather, and also he was a registered practitioner during the British period, Dr. Vaidya Gurbasaya Hiramat, and also he successfully treated the many cases and got fruitful results. So now I have taken this study for the research work, because no any scientific study has been conducted so far as to validate it. So the hidden treasure of the plants and mineral based medicine has been practiced since immemorial time as a traditional medicine or a folklore medicine. So the Sutakadakuttiye Vati is evidently used in a folklore practice with a significant efficacy. Next slide. So this is a review of literature which my grandfather has taken from the manuscript, and aims and objective of this study is to standardize the Sutakada Kuttige Vati, a folklore medicine, and to validate its clinical efficacy in Kashtartava. Methodologies, it is collected from the handwritten document, the references and the ingredients of Sutakada Kuttike was procured from the vendor and authenticated. The vati was prepared as per as a handwritten document. And 20 subjects with their informed consent with the clinical study were selected from the attending IPD, OPD around the study center, that is our college RGS EMCH road, based on the parameters. Next slide. These are the selection criteria and diagnostic criteria. The selection criteria, inclusion criteria within the age group of 14 to 25 years with a painful menstruation at least 3 consecutive cycles, and the patient with a irregular menstrual cycle and both married or unmarried. And subjective criteria is Rajakruchrita, Arthava Pramana, Krishnavarna Arthava Shrava, and Arthava Shrava Avadi. So these are the exclusive criteria and also objective criteria. Next slide. Clinical intervention is Sutakada Kuttige Vati, 500 mg tablet per day along the goat's milk 1 hour prior to the breakfast for 15 days, only 15 days from the first day of the menstruation they have to take. And today the total duration is for 3 cycles or 3 months. Assessment with a statistical analysis considered for the analysis, baseline and assessment data were considered for the analysis for the assessment and the intervened using the student t-test. Next. These are the results and the analytical study was done, and these are the ingredients which I have prepared. So this is the Sutakada Kuttige Vati. After the delivery, the Sutika, which the pain will be there. So for that, it is given, and it is also indicated in other diseases also. Analytical study for the raw drug establishment, authentication, and the purity of the raw drug was used for the formulation. Next slide. These are the subjective parameters where the highly significance in Rachakrichrita, Arthava Pramana, and Krishnavarna Arthava. Only the significance in Artha Shrava Avadi. Next one. The assessment of the objective parameters was showing the highly significance in pain radiating to the lower abdomen and the depression and backache and appearance of acne. Other significance will be the fullness and tenderness of breast, fullness and tenderness of breast, and abdominal bloating also. Next slide. And the discussion is Sutakada Kutti Vati, which is a formulation which we have taken from the handwritten. It is indicated in not only the Kashtartava, Paitika Shula, Sutika Shula, Vandhetva, and in Yoni Shula also. And the ingredient are Arda Haritaki, Ajamoda, Shunti, Lata Karanja, Krishna Jiraka, Shweta Jiraka, Arka Mulatvak, Hingu, that is the Grita Barjita Hingu, Pippali, Maricha, Shweta Punarnava, and Lashona. And where the processes the wide range of therapeutic properties as a Kaphavata Shamaka, and it is given for the 3 cycles. And also the observed parameters were observed, immediate relief in a pain in observed in these 3 consecutive cycles. And the Ushna Guna of the key ingredient probably induces the Deepana, Pachana. Next slide. Sutakada. It is evidently phenomenon faced by every woman once in her lifetime, and considering the presently folklore formulation, this formulation can be a multi-beneficiary in terms of correcting the hormonal level and normalizing the Vatadi dosha, thereby regulating the proper physiological process with its specific action. And the ingredients are found as Kaphavata Shamaka in treatise of Ayurveda, and the clinical intervention showed the significance, highly efficacy in the management of Kashtartava. As well, I have seen 2 patients which is results in one death also, validating its clinical practice. Next one. Next slide. These are the references which references. So this is the handwritten document, the Sutakada Kuttige Vati. These are the drugs and the procedure they have mentioned there only. So at the last they have given E Aushada Tegedukondare Makkalaguvu. That is, I have seen only in 2 patients. Out of 20, only 2 patients I got the results for infertility. That too primary infertility. And this is the certificate that is during the British period, the registered practitioner in Indian medicine 1949, that is GG Vaidya Guruvasaya Hiremat. So I would like to express my special gratitude to Tadvidya Sambhashana Parishat Trust Committee members, and also I would like to gratitude to my guide also, Dr. I.B. Kotteshetty sir, who has supported me, and also I will cherish my sincere thanks to Dr. Shashikala Bani ma'am also, which she has guided me. Thank you so much for it.
Thank you, doctor.
Thank you.
The time taken is 5 minutes 52 seconds. Panel is open for discussion.
Dr. Vaibhavi,
Namaste, ma'am.
Namaste. Have you, even though your grandfather has practiced this, just 2 questions I just wanted to rectify from you. Whether those drugs are being authenticated?
Yes, ma'am, sure. Authenticated.
From where those drugs are being authenticated?
I have taken from that Dhanvantari medicinal shop is there, ma'am, there. And my father used to take from there only. And he was also authenticated. And he was seen. And then I was also seen, ma'am. One that is a Arka Mulatvak I have taken from my land only, ma'am. Arka Mulatvak.
No, any drug you take from anywhere. Either you take from GMP or from any of the medical shop or from your field. It has to be authenticatively authenticated from any of the research centers.
Ma'am, in Rona College, Manjunath Ajnal sir was there, na, ma'am. I have shown to them, ma'am, research center lab only there. And I have shown
you
them.
Have that authentication letter with you? They have been certified from the research center?
That Rajivan, this is the where I have given these drugs, ma'am, and they have and I have given for analytical study also, ma'am, for these drugs.
See, first authentication is needed. Authentication, analytical, standardization, everything has to be done when any drug used to be used on the patient.
Ma'am.
Got it? See, folklore, even your grandfather is been practicing from the ancient days, but nowadays research are taken in such a wide perspective. They need everything from authentication, from the standardization, from the analytical. All these things are retrospectively they have to be done. Research before you give any medicine or any type of things to the patient or any type of animal study you want to do. Those are to be authentically certified from some research center. If your college is having some research center, Rajiv Gandhi College is having some research center, from the research center, it has to be authentically rectified by the whoever is the head of that research center. I think who is the head there? Research center?
Dr. Manjunath Ajnal sir.
Manjunath Ajnal sir. Sir might be head of that research center, right? So you may be having some documented letters. Your grandfather is being taken a copyright of that?
Ma'am.
Book is being published? Any book is being published related to that?
No, ma'am. It is not published, ma'am. Not copyright anything. Just I have because my father was practicing now, ma'am. So I have taken that drug, ma'am. How it will work?
Or you have done any patent related to that?
No, ma'am. Still not it, ma'am.
Because when you are giving publicly this opinion, somebody may steal these things and they can take their own this one.
But
you understood my concern, right?
I understood, ma'am. But one drug or two drug I have not mentioned in this, ma'am.
Why?
But that will be Barjana and all, and also that Barjana and all I didn't showed, ma'am. Only how.
See, then the expected result, there may be some fluctuating in the results, right?
No, ma'am. I have given and I have I have prepared as per as manuscript only, ma'am.
But you are not mentioned.
Not mentioned in the sense only drug I have mentioned. How they used I didn't mention, ma'am. Only drug I have mentioned, ma'am. How they used and how they did, I didn't mention anything about that, ma'am. Because if that drug has mentioned, then only the if how they written, ma'am, and how they while they practicing, they told to my father how it should be used and how it should be prepared.
That is what it is called as standardization, right?
Ma'am.
Because any medicine, if you are using, it has to go through all these processes. This is my own view. I don't know about other judges.
Yes, ma'am.
From my side, the questions are it. Thank you.
Thank you.
Dr. Vaibhavi, usually when the formation is mentioned in the grey literatures, and when you are coming up with standardization, you need to reveal all the drugs and all those standards what the grey literatures have mentioned. Only then your study will be complete. Okay. And one more thing, is there any specification when to collect Arka Moolatwak, in which nakshatra? Usually in the grey literatures, they usually mention it.
Yes, ma'am. Because we are the Swami, like Manetana and all, na, ma'am. We know how to read the Panchanga and everything. And also I have prepared the drug also in the good nakshatra, good timing and everything, ma'am. That also they told.
Then don't you think that it is essential information that has to be shared?
Yes, ma'am. I'll share, ma'am. That nakshatra and timing also I'll tell you.
Okay.
Thank you.
The study duration is only 3 months, ma'am. 3 months you have given, no?
Because they have not mentioned 3 months, ma'am. But I have taken because it will take much time now, ma'am, for other patients and all. But cycles will come only once in a month now, ma'am. So I have taken 3 consecutive cycles. Then only I'll come to know how it will work and everything, ma'am. With that cycle period and everything, that menstruation and all, how I can dysmenorrhea during the menstruation, how I can assess. For my sake, I have taken 3 months, ma'am. Because and I have given for patient also in my clinic, ma'am. I have given till 8 months, ma'am, to conceive that. I have given up to
Same
8 months
formulation
to conceive that one.
After living medicine, patient got the same kind of problem again?
No, ma'am. No. Sure, ma'am. No, till now. But 2 patients only I have continuously talking with them. But still they have not, ma'am. Only 2 patients I got.
Reoccurrence. There is no reoccurrence.
Ma'am. No, ma'am.
Okay. Can you show the ingredients again, ma'am? Only some of the ingredients I have seen.
She herself said, madam, she did not mention few of the medicines.
Yes, ma'am.
when you are making the things partially dealing with the case studies,
ma'am,
then what will be the result?
Ma'am,
See,
I'm not
your grandfather, see, 1 minute. We are not against the things. When your grandfather or your father are practicing since from so many days, it is being our generation to carry on those folklore medicine. Is that clear? So when they are given everything in a ready-made, our duty is to carry those things. Maybe because of some lack of time, maybe because of some other things you might have missed. But whenever some things we are carrying, it is our born duty, being this generation, to carry those things. So that's what sir also suggested. When you are doing anything, you should mention even nakshatra also, time, tithi. Everything you are supposed to mention, because in Ayurveda we already know Kala and Disha plays a very important role in collection, preservation of the medicine.
That is sure, ma'am.
Right?
Because, ma'am, I have mentioned all drugs, ma'am. I haven't skipped any one drug also, ma'am. Because there are so many formulations they have mentioned in that manuscript also, ma'am. Because everyone can know and everyone can practice that medicine and all. That's why I'm telling, and that's why I'm exploring.
That's why I asked you whether you have taken copyright, whether you have taken patent. That's the reason I asked you.
No,
that's
ma'am,
the reason
because still another drugs, still more drugs are there, ma'am. I will take, but now in PG also, I am doing another research also, ma'am. That to folklore medicine only.
It's okay. We wanted to convey you what all are the things you are supposed to follow in the research, being a research scholar or PG scholar.
Yes, ma'am.
I think done from our side, Deepa madam and sir, Agnihotri sir.
Yes, ma'am, I am done.
You can go with the next presenter, Dr. Harshita.
Yes, ma'am. Yes, ma'am. Thank you, Dr. Vaibhavi. Our next presenter is Dr. Pratibha. Please keep your video on, doctor.
Yes, ma'am.
Am I audible, ma'am?
Yes, you are audible. And your time starts now.
Shri Gurubhyo Namaha. Myself Pratibha from 3rd Professional BMS, SHEMC Koppal. I am presenting about the topic Viddhagni Karma in chronic secondary headache, a mechanistic and clinical evaluation of its role in pain modulation. Ma'am, 1 second, ma'am. As we know, most of the people in the present era are suffering from chronic pain. Approximately 19.13% of Indian adults suffer from chronic pain. As per ICD-11 classification, chronic pain is classified into 7 subtypes. Among them, chronic secondary headache is also one. Headache disorders affect 65% of the global population annually. Chronic secondary headaches persist for over 3 months and often refractory to conventional pharmacological treatments like NSAIDs and triptans. The primary aim is to evaluate the efficacy Ma'am, 1 second, my screen is not changing. Primary aim is to evaluate clinical efficacy and safety of Viddhagni Karma in the management of chronic secondary headache through counter irritation and neuromodulatory mechanism. It also aims at pain assessment, mechanistic analysis, and safety evaluation. Introduction to Viddhagni Karma. It involves piercing specific anatomical sites to create controlled stimulus. As per Agni Karma, it uses controlled heat to treat local inflammation, and thermal effect causes localized tissue dehydration and contraction, enhancing blood flow and accelerating cellular heating. When we combine both of these procedures, it offers enhanced precision and reduced tissue damage and better patient compliance through single session procedure. As we know, basically, chronic secondary headache is broadly categorized under Shiroroga and Vata Vyadhi, reflecting complex neurological and structural imbalances. Here are some of the headaches which are correlated in Ayurveda, as mentioned in the slide. As per the clinical procedure, there are some criteria. In the inclusion criteria, age in between 18 to 60 years with chronic secondary headache and failure of more than 2 conventional regimens are considered. Exclusion criteria, red flag features and bleeding disorders or scalp infections are not considered. Requirement, normal coagulation profile and informed written consent should be mandatory. Absolute contraindications are like avoid marma points like Adipati, Shanka to prevent vascular or neurological injury. As we know, marma is the seats of prana. Marma is the anatomical site where muscles, veins, and ligaments, joints, and bones intersect. Stimulating these points through Viddha Karma triggers the release of endogenous ophides like endorphins, providing natural and potent analgesia. Understanding marma is more critical as improper stimulation can lead to severe injury or permanent neurological damage, that is marmagata. As we know, this is the main topic, the paradox of therapeutic nociception, how pain-inducing relieves pain. The human pain system possesses endogenous inhibitory mechanism evolved for survival. When a controlled acute noxious stimulus like Viddhagni Karma is applied, the brain interprets it as a new threat, allocating attentional resources and activating descending inhibitory pathways to modulate all incoming pain signals. At the site of the periodic gray, neurochemical substances like beta endorphin and enkephalin are released. This acts in supraspinal analgesia and command center activation. At the site of rostral ventromedial medulla, neurochemical substances like serotonin and norepinephrine are secreted, which helps in descending inhibition of pain signals. At the site of dorsal horn, dynorphin and GABA are secreted, which helps in segmental inhibition of WDR neurons. At the site of peripheral tissues, endomorphin adenosine are secreted, which helps as local analgesia at the site of stimulation. A mechanism of action, as per Ayurveda, Vata Shamana, Agni's heat contracts Vata's coldness. As we know, Shita Guna is Guna of Vata. Here, Ushna Guna of Agni contracts Vata's Shita Guna, and it also helps in Shrotra Shodhana. Heat liquefies obstructed kapha and clears inflammatory toxins. That is, thus, Vidya and Agni Karma togetherly clears the arm of the pain itself. As per modern gate control theory, activation of large alpha beta mechanoreceptors and A gamma thermoreceptors inhibits chronic C fiber pain signals at the spinal level. Thus, it acts in this way. As per DNIC, brainstem recognition of noxious thermal stimuli triggers descending serotogenic and noradrenergic pathways to inhibit pain. At the part of discussion, okay. At the point of discussion, there is evidence gap, neuroplasticity, and standardization. As a part of concluding, we come to know that the key takeaways are effective alternative offers a viable therapeutic option for those who says a big no for adverse effects of long-term use of media management, long-term use of NSIDs and neuroplasticity. And it is a holistic and scientific. It is safety and precision, future, and so it acts as it helps in attaining future potential. References are as mentioned in the slide. Thank you.
Thank you. The time taken is 5 minutes 50 seconds.
Can you just repeat your topic title?
Viddhagni Karma in chronic secondary headache, a mechanistic and clinical evaluation of its role in pain modulation.
Have you seen that Viddhagni Karma?
Yes, ma'am. I have seen, like in our college, from the Department of Shalakya Tantra, they practice Viddhagni Karma in Shirashula, ma'am. Even they got results. I have asked them.
How many patients you have seen?
Ma'am, around like 2 to 3 patients. As I am in third professional, I have seen just 2 to 3 patients.
But you are presenting here, no?
Yes,
in the third professional, you have seen 2 to 3 patients. You are saying.
No, I interacted with them and asked for the results and outcomes, how it is. As I thought in this Viddhagni Karma, we are in the pain condition, we are inducing pain, no ma'am. So I thought to explain how it gonna help to relieve pain.
Whose patients they were in your college?
Sir,
who's practicing Viddhagni Karma in college? You belong to
the
which
PG
college?
scholars are working on that, ma'am. So I asked.
See, even PG scholars are working means somebody must be guiding them, no?
Yes, ma'am.
They cannot do by themselves. If you are taken cases from Shalakya, you belong to which college?
SCGMC Koppal.
Koppal. Okay. Who is practicing the Viddhagni Karma? I think there must be some expert, no, to practice that Viddhagni Karma.
I'm not knowing that much in detail.
No.
See, Sambhahsa has guided you. No, I'm just asking you. Sambhahsa has guided you.
Yes, ma'am.
Sir belong to Samhita Siddhanta department.
Yes, ma'am.
And you have seen a cases in Shalakya.
I have seen, ma'am, like performing on the patients.
Let me finish my words better.
Yes, ma'am.
Yeah, you have seen. While seeing, you might have been interacted with the patient along with the one who is treating them.
No, ma'am, I have seen like far, like around 2 to 3 months earlier. And now, I have recently decided to do on this topic, no, ma'am, so I interacted with them.
When you seen these patients?
Like around 2 to 3 months before.
When this Tadvidya Sambhasha you decided?
I recently decided, ma'am, often.
You have seen a patient 2 to 3 months back. Recently, you decided to do a presentation. And when PG students are doing Viddhagni Karma cases on a patient, maybe it is their trial, their research work.
Ma'am, even when I attended some one seminar, ma'am, in the Mysore, I have seen a doctor performing on the patients, ma'am.
Who is that doctor?
In Udupi clinic, Vaidya Rohit Prabhu. They are even famous for Viddhagni Karma, ma'am. So I have seen there.
When you're seeing in your college, you have such a beautiful Shalakya department, if I'm not wrong.
Yes, ma'am.
I think many of the teachers of your Shalakya, they are doing many of their Kriya Kalpas and all of other treatment modalities with related to migraine or else ENT and all those things. So there must be some expertise in the research area with related to that. Because without any expertise a person may be PG or you cannot perform on that. That is my question. Under whose guidance those things are going on? Because unless and until you get some queries, when you want to rectify the queries or the results, you need to discuss with the expertise person.
Yes, ma'am.
Yes or no?
Yes, ma'am.
You have taken a content and presenting by the guidance of Sambhahsa. Am I right?
Yes, ma'am.
No more questions.
Thank you, ma'am. Moving to the next presenter, we have Simran S. Karoshi.
Yes, ma'am. Am I audible?
Your time starts now. Yes, you're audible. You can begin.
Okay. Good evening, everyone. I am Dr. Simran S. Karoshi, second year PG scholar from SDM College of Ayurveda, Udupi. Today, my topic is Garavisha concept in the evaluation of chronic cosmetics toxicity. Next slide, please. In the modern era, cosmetics are not merely luxury products but have become a part of daily lifestyle. Most cosmetics contain synthetic chemicals such as parabens, phthalates, steroids, and heavy metals, which are continuously applied over long duration. Though these substances may appear safe in small quantities, their repeated exposure leads to accumulation in the body, causing subtle but progressive toxic effect. In Ayurveda, there is a similar phenomena under Garavisha, where toxins formed artificially produce delayed and chronic effects. Next. In Charaka Samhita Chikitsa Sthana, Acharya explains about Garavisha. It is a poison formed by combination of various substances, that is Samyogaja Visha, producing diseases after a certain period of delayed metabolic process, that is Kalantara Vipakya. Unlike acute poisons, it does not cause immediate death and produce chronic pathological conditions. Chakrapani comments that it is Chirakari Roga Janaka, which means it leads to diseases that persist for a long time. This clearly indicates that ancient acharyas has conceptualized slow-acting cumulative toxicity, which aligns with modern understanding. Next. Features of Garavisha, that is cumulative effect. It is artificial origin, that is formed by incompatible or mixed substances. Alpavirya, that is low potency, not immediately lethal. Kalantara Vipaka, that is delayed action from after metabolism. There is cumulative effect, that is gradual buildup in the body. Chronic disease manifestation. These features make it difficult to diagnose early and resemble modern chronic toxic exposure patterns. Next. Chronic toxicity, which is harmful effect produced due to repeated exposure to low doses of toxic substances over a prolonged period. There is delayed onset of symptoms, progressive tissue damage. There will be multi-organ involvement and often irreversible changes. Studies have shown that about 50% of skin fairness creams available in the India contain steroids. Due to long-term use, it accumulates in the body and causes irritation, increased susceptibility to infections, kidney and liver damage, reproductive toxicity, and carcinogenicity. Next. Cosmetics and toxic ingredients. It has steroids in fairness creams. There will be presence of steroids, heavy metals like lead, arsenic, and mercury, preservatives like parabens, and fragrances and stabilizers. There is long-term usage of these leads to skin thinning and barrier damage, increased susceptibility to infections, systemic toxicity, and affecting liver and kidneys, endocrine and reproductive disturbances, possible carcinogenic effects. Next. Mechanism of toxicity. There will be absorption. These chemicals enter through skin, through a transdermal route. They circulate through body to various tissues. They get accumulated in the fat, liver, and other organs. Cellular interference affect enzymes, hormones, and metabolic pathways. Leads to organ dysfunction over time. Next. Clinical manifestations can be local and systematic. In dermatological, there will be red patches, itching, burning, severe sensation, severe swelling, and dermatitis caused by fragrances, preservatives, and dyes. Hair care effects. Hair dyes and relaxers often cause hair loss, hair shaft breakage. Then there will be skin discoloration changes due to heavy metals in the cream. Systematic and neurological symptoms will be due to mercury or lead in the creams, lead to headaches, dizziness, fatigue, tremors, memory loss. Endocrine disruption. Some cosmetics contain ingredients that are hormone disruptors like BPA.
30 seconds left.
Eye and throat irritation due to shampoos and cleansers and aerosol products. Next slide. Acharya Shushruta has explained in Kalpasthana various comparative analysis which we can compare. That is Garavisha, that is artificially prepared, and in cosmetic toxicity there will be chemically formulated product. Garavisha is slow acting, and cosmetic toxicity can be gradual toxic exposure. There will be cumulative effect in Garavisha and bioaccumulation.
The time is up.
Cosmetic toxicity. There will be chronic disease and long-term health issues. Next, management can be by Shodhana based on the conditions, acute and chronic. For acute, Shamana Chikitsa, and chronic Shodhana Chikitsa. Drug therapy, Deepa, Pachana, Vishagna, Krimigna, and Kushtagna drugs. Agada yogas can be Mahasugandhi Agada, Dashanga Agada, Bilvadi Agada, Dushi Vishari, and Murvadi Agada. Special procedures like Tikshna Varmana and Virechana and Sira Veda can be done. External applications with Kottam Ramachadi Churna, Shigru Punarnavadi Lepa. Next. Prevention, Nidana Parivajana, that is avoid cosmetic usage, follow Dinacharya. Balanced diet is required, maintain positive attitude and self-acceptance. Prefer traditional herbals. Next. Chronic cosmetic toxicity closely parallels the concept of Garavisha due to its low cumulative and chronic nature of toxicity. Ayurveda offers a holistic and preventive framework through avoidance of causative factors and use of natural therapies. Thank you.
Ma'am, the time taken is 6 minutes and 15 seconds. We are open for discussion.
Have you seen clinically practicing these concepts, what you have taken, Dr. Simran?
Ma'am, in our OPD in our college, we have seen some of the eczema conditions due to the cosmetic application of, there is a skin lightening cream called Skin Light. We have seen eczema conditions in the patient.
So you're using Garavisha there?
Yes, ma'am. We consider under Garavisha like Nidana. Nidana will be considered as Garavisha.
What are those you are using?
What, ma'am?
What are those you are using?
We first tell the patient to avoid such thing. Then we go for Virechana for the patient, depending on the condition of the patient. Then there will be we recommend for external applications.
What all are the Samanya Nidana you have seen?
Samanya Nidana, ma'am, they see through Instagram and they buy the products repeatedly if they do not get any desired.
That's my question. They see the Instagram, they see the social
Yes,
media,
ma'am.
and they start using. Which
They
all are
start
those
using-
common ingredient products you have seen in the patient, repeatedly used by many of the patient?
Ma'am, there will be mostly parabens present in the products.
What paraffin? What are the
Parabens.
brand name of those particular products?
Brand names, I'm not that sure about that, ma'am.
Because they won't be knowing the content of those. They will be usually seeing going through the what we call it as the brand name only. For example, like Lakme or else some other brand names like the companies, the most companies, what sugar like this. There are brand names. So which all are the, for example, if you have seen a 30 patient, among 30 patient of sample size, how many patients are used most commonly ingredients of those products?
Ma'am, I have seen mostly they use one particular product, that is Skin Light. There is a cream called Skin Light. I have seen that usage, and there is a brand Body Voice. I have seen the patient using that product for hair treatments.
You belong to which department?
Agada Tantra, ma'am.
Agada means most core component of your subject is Garavisha or Lokivisha only.
Yes, ma'am.
Your departmental subject is, you are a PG scholar.
Yes, ma'am.
Then whenever you are taking a case history, the first and foremost your focus will be on the Vidhana itself.
Yes.
Yes, sir. Whether it belongs to Garavisha or Lokivisha.
Yes, ma'am.
So under which category? Because nowadays whatever you are getting a patient, rather than the olden days, 80% of the patient will be related to skin disorders.
Yes, ma'am.
And among the 80, again the higher rate will be related to cosmetology.
Yes, ma'am.
Agree with that, because the social medias and all are impacting the people to follow all those things.
Yes, ma'am. Yes.
So you have to start with the root, what we call it as Nidana Parivartana.
Yes, ma'am. We need to firstly make the people, we need to spread the awareness regarding that among the people.
That's what sometimes there will be a adverse effect, what we call it under through pharmacovigilance.
Yes,
we go with the public domain.
Yes, ma'am.
How to spread all these things, what all are the people are going to adulteration, all those things, right?
Yes,
so you have to more focus on those things whenever you are taking a case history, which type of the cosmetology they are using, and commonly which all are those cosmetology which are coming under your Garavisha or through which you are going to consider for a fix, right? Okay. More concentrated. Thank you.
Yes. Thank you, ma'am.
Madam, what are the diseases you observed due to Garavisha and how you are treated? One or two examples.
Ma'am, we have seen mainly eczema cases. We went for Shodhana of the patient. We mainly go for Virechana.
Virechana.
Yes,
and
ma'am.
other conditions? What are the other conditions you observed?
We have seen hair dye related skin contact dermatitis we have seen, ma'am.
Contact dermatitis, like advanced pigmentosa, melasma, and everything is due to continuous usage of all cosmetics.
Yes, ma'am. Yes, ma'am.
Okay.
Mr. Harshita, we have done from our side. I think Deepa madam, you have been done.
Yes, ma'am. Yes.
Dr. Agnihotri sir, are there any questions? Or else we can go to next presentation.
Next presentation.
Okay, ma'am.
Thank you, ma'am.
We have the next presenter, Dr. Basavaraj.
Slide, please.
Yes, you may proceed.
Good evening all. Myself Dr. Basavaraj, Department, second year PG Scholar, Department of KAHER Chikitsa from Sri Sri Ayurveda College. Title, Understanding the Diagnosis and Management of Vicharchika through Ayurveda Principle, a case study. Introduction. Vicharchika is one among the Kshudra Kushta explained by Acharya Charaka in Chikitsasthana 7th chapter, which having the following lakshanas like Pidaka, Kandu, Shavavarna and Bahusrava. By considering these symptoms, Vicharchika can be correlated with cellulitis or dermatitis or eczema. In modern science, assigned with the signs and symptoms of both are more similar. Patient information. A 81-year-old female patient named Indra presented with the complaints of itching sensation, blackish and reddish discoloration of skin, white-colored lesions with excessive sporulent discharge over right and left anterior part of legs, including ankle joint, more in the left leg since 1 year. Also, patient is a known case of rheumatoid arthritis since 4 years and asthma since 40 years and not on regular medications. She used to take medications for asthma, but she's not using any medications for rheumatoid arthritis till now. By considering above complaints, an Ayurvedic diagnosis was made as Vicharchika. Clinical findings. General examination. What about like pallor, icterus, cyanosis, clubbing and lymphadenopathy are absent. Integumentary examination of bilateral lower limb. That you can see the picture there. The patient is having that whitish discoloration of lesions, reddish and blackish discoloration of skin, along with the sporulent discharge from the lesions. Diffuse erythema involving the anterior, medial, and lateral aspects of the leg extending up to the ankle. The skin appeared tense, that is tanurtvacha, and shiny, suggestive of underlying edema. Few serious oozing points and scab formation were visible. The ankle region appeared swollen with loss of normal bony prominence. The swelling is milder in nature. No obvious deformity of the limb was seen. No visible varicosities were noted. On palpation, local temperature was raised compared to surrounding areas. Edema was present, likely pitting in nature. Timeline of the events. First, I have seen the patients in the March 2025. There is a blackish and red discoloration of the skin associated with the whitish lesions, which is having sporulent discharge from the lesions. Along with it, swelling was present in the ankle joint. In the mid-March, you can see I have used one minute. I have used that prunolol and trichoderma ointment in the mid-March 2025, and it is that ointment still it's going on April 2025. You can see the changes from mid-March 2025 to May 2025, that blackish discoloration, oozing, or sporulent discharge that got reduced in May 2025. Next. In the mid-May, after using the ointments and all, she got that swelling in the bilateral ankle joint. You can see there. There is a tanurtvacha also in the bilateral ankle joints. For these swelling and all, we have given Dashanga Lepa and Manjishtadi Lepa. Next slide. You can see it here. By mixing Dashanga and Manjishtadi Lepa over bilateral limbs and ankle joint, you can see the noticeable changes here. In the May end, we have applied that Dashanga and Manjishtadi Lepa. In the June starting, there is a mild reduction in swelling and redness also. In the June end, there is no swelling was seen. Next. Diagnosis. Based on the Lakshanas and Dosha Pradhanata seen, we diagnosed it as Vicharchika and treated accordingly. Intervention. External line of management we have given here is Panchavalkala Kvata Dhara for 2 months. The Dhara it is given in the morning ones and the night ones. After the Dhara, we have given prunolol and trichoderma ointment by mixing it by mixing both for 2 months. Dashanga Lepa, when swelling was noted, it was given for 15 days. Steer skin lotion for dryness for 3 to 4 months we have given. Internal medications. Capsule grab, it is given 1 BD after food. That Kadirarishta and Manjishtadi Kada. Kadirarishta given 10 ml
30
BD
seconds remaining.
Manjishtadi Kada 10 ml we given before food. And along with that, Kamaduga Moktika Yukta 2 DID we are given before food. These medications are given for 3 months. Next slide. Before treatment and after treatment, you can see the noticeable changes. There is a blackish, red, that oozing, sporulent discharge and all in the before treatment. And after treatment, you can see the noticeable changes here. There is only mild blackish discoloration. Along with that, only dryness is remained now. Next slide. Conclusion. The present case represents a chronic inflammatory dermatological condition of the lower limb, clinically presenting with edema, itching, blackish red discoloration, lesions with a sporulent discharge. Based on classical signs and symptoms, it was diagnosed as Vichachika, involving predominant kapha pitta dosha dushti with rakta involvement affecting tvak, rakta, lasika and mamsadhatus. The manifestation of Kandu, Srava, Pidaka and Vrana Vikruti clearly indicates dosha samurchana with chronicity and local suratadrishti. By seeing significant clinical improvement was observed in terms of reduction in lesions and edema, decrease in discharge and itching sensation, improvement in skin texture and discoloration. Next slide. Acharya Charaka told that Vicharsika is a kapha dosha predominant in Charaka Chikisasana 7th chapter, and Sushrita told that it is a predominant of pitta dosha predominant. By considering these things and by seeing the associated signs and symptoms, I have considered it as both pitta and kapha dosha pradhanatva and treated accordingly. In conclusion, Ayurveda offers a safe, holistic and effective modality in managing such dermatological conditions with the added advantage of addressing the root cause and preventing reoccurrence. Thank you, ma'am.
Ma'am, the time taken is 6 minutes and 20 seconds. We are open for discussion, ma'am.
It is a single case study or how many cases you are saying?
Yes, this is a single case study only, ma'am.
What is the nidana in this patient, sir?
Ma'am, actually, she's a known case of rheumatoid arthritis, but she's not taking any medications for the same. Due to that, there is no, then the main nidana is chest of both the limbs, ma'am. Due to chest of both the limbs, there is no proper circulation of both lower limbs. Due to that, there is pitta and kapha dosha pradhanata leading to the Vichachika, ma'am.
What is the occupation of the patient?
Ma'am, actually, she's a bedridden patient, ma'am. She's like some 10 to 12 years. She's a bedridden only. She can barely move both the lower limbs, ma'am.
Bedridden means what was the past history?
Past history, there is no exact past history, ma'am. She's a known case of only asthma and rheumatoid arthritis, ma'am. Due to rheumatoid arthritis she's because of not taking any medications, she's on bedridden, ma'am.
What is the age of a patient?
Ma'am, it's 81, ma'am. Barely she can sit on the chair. She can move both the limbs. That's it, ma'am. She can't be able to walk or stand properly, ma'am.
Now, what is the condition of patient? Now she is able to move?
No, ma'am. That movements and all, it is rarely she can move, ma'am. Barely she can move, but she's not able to walk or stand alone, ma'am.
So only you have treated Vichachika, along with that you have treated rheumatoid arthritis also?
Yes, ma'am. Only Vichachika I have treated, ma'am.
The patient not asked for the rheumatoid arthritis
treatment?
No,
ma'am. She's fed up with that rheumatoid arthritis, ma'am. So she doesn't want to take any medications for the same.
If you are treated only for Vichachika, the patient is not being treated with rheumatoid arthritis.
Yes, ma'am.
So again she will be lying on the bed only.
Yes, ma'am.
Then again there will be a repetition of these symptoms.
I asked her for the same, ma'am, but she's like, I don't want any medications for this rheumatoid arthritis and all. Just cure my skin condition and leave me alone, like this. She used to tell, ma'am.
Because age is also one criteria, and her main nidana is rheumatoid arthritis, where she is not ready to take a treatment for that, which is the secondary effect of this Vichachika.
Yes, ma'am. Actually, almost all the complaints can be correlated to Vatarakta Vapat, ma'am.
See, when you are not treating the primary symptoms, then what is the effect of this secondary treatment you are giving with the Vichachika?
Yes, ma'am. But as of now, she's not complaining of any complaints regarding any skin issues, ma'am.
Okay, I do agree. But don't you think that there will be again a reoccurrence of these symptoms?
It might reoccur, ma'am. Before she used to take anti-steroidal creams, antibacterial ointments and all, but it reoccurred again. So she
No,
came to my
again,
clinic.
for rheumatoid arthritis also she might be taking something.
But as of now, she's not taking anything, ma'am, for rheumatoid arthritis.
Then I don't think so. Our Chikitsa Siddhanta is going to work out there.
Only localized treatment we given, ma'am.
Punuradbhava Chikitsa I have to give. But here in this condition, there is again chances of reoccurrence. So you have to treat main disease, you have to convince the patient.
Yes, ma'am.
Okay, then from our side, Dr. Harshita.
Yes, ma'am.
Thank you.
From my side also.
Okay, ma'am. Dr. Agnihotri, sir, any questions, sir?
Done.
Okay, sir. So, thank you, Dr. Basavaraj. Moving on to the next participant, Dr. Pratibha Sakre.
Good evening, ma'am. Am I audible?
Yes, you may proceed. Yes, you're audible. You may proceed.
Good evening to the panel. I'm Dr. Pratibha Sakre, second year PG scholar, Department of PG Studies in Ayurveda Samhita Siddhanta. Title: An Ayurvedic Perspective on Nidra Disturbances through the concept of Satmendriyartha Sanyoga. In today's rapidly evolving lifestyle, we are constantly exposed to excessive screen stimulation, be it through screens, noise, or irregular routines. While these may seem harmless, next slide, please. These are the contents. Yeah. While these may seem harmless, they subtly disturb one of the most essential pillar of life, which is Nidra. Ayurveda explains this through the concept of Asatmendriyartha Sanyoga, which highlight the improper previous slide, please. Introduction slide. Yeah. Asatmendriyartha Sanyoga, which highlights the improper use of sensory organs as a key cause of imbalance. Through this presentation, I aim to explore the Nidra disturbances, how it affects the sense organs. Nidra helps to maintain the proper equilibrium state of dosha, dhatu, and mala. The first part of Nidra is predominant in Kapha dosha, and disruption in sleep patterns can lead to imbalance of Tridosha, resulting in respective vitiated dosha symptoms. The contemporary science also described the proper sleep helps in body to repair tissues, muscles, and cells that were damaged. It also helps restore the sensory levels by conserving and rebuilding the metabolic disturbances. India report that poor sleep quality affects around 50 to 60% of the adults, while insomnia prevalence ranges from 15 to 25% of this general population. Currently, in fast-moving era, the person has over-dependency on the gadget, which affect the sleep quality. Overuse of sense organs and sleep ignorance, how it affects in causing the disease will be discussed further. Next slide, please. Review of literature. यदा तु मनसि क्लान्ते कर्मात्मनः क्लमान्वितः विषयेभ्यो निवर्तन्ते तदा स्वपिति मानवः तमोभावः श्लेष्म समुद्भवः च मनः शरीर संभवः च आगन्तुकी व्याध्यानुवर्तिनी च रात्रि स्वभाव प्रभाव च निद्रा. The Prakrita Nidra is considered when the manas and Indriya Vishayas are taken out. Then the Prakrita Nidra will happen to that person. If at all that doesn't happen, it is considered as a Akala Nidra. Samanya Vatavadi Nidana, when we trace it, it includes Prajagara, Vishama Upachara, Dukashayasana, Krodadi, Divaswapna, and Vega Sandarana. These lead to the vitiation of Vata, leading to the Dehe Srotamsi Riktani Purayitva Anilo Balihi, Karoti Vishaman Rogan, Vyadin Sanjayate. This Prakupita Vata takes place in the Khavaiguna places, leading to the Srotadishu Indriya Vadam Purya Dushta Samirana. It takes place in the Indriya and leading to the vitiation of Indriya and Indriya Artha. Next slide, please. When we go for Vata, next slide. When we go for Vata Shiroga, Uchchair Bhasha, Atibhasha, and Prajagara Vega Nigraha, these becomes the Nidana for the vitiation of Vata Prakopa, which takes place in the Indriya like Karna, Jiva, and Chakshu, along associated with Manas, leading to Vata Shiroroga. The same Samprapti we can trace for Kapha Shiroroga, where Nidana becomes Asasuka and Sapna Sukha. The Prakupita Kapha takes place in Bahulya Srotasam Avrunute Kapaha. leading to the vitiation of Panchendriya and Manas, leading to the Kaphaja Shiruroga. Next slide, please. Next slide. The Nidra leading to the Agni Vikara, how we can trace is, in Charaka Chikitsa 15th chapter, Acharya mentions that Tanmana Bunjita, when the person is excessively stimulating his or her indriyas by Chinta, Shoka, Bhaya, Krodha and Prajagara, it leads to the Agni Dushti, where Asatmendriyartha Sanyoga of Panchendriya along with Manas can be traced. Next slide, please. Next slide. The relationship between sleep quality and metabolism, the
30
circadian
seconds
rhythm
remaining.
regulates major gastrointestinal functions such as motility, secretion, and digestion. The GI tract has its own peripheral circadian rhythm, and the pattern of digestion and metabolic activities followed. The timing of food acts as a major regulator of intestinal circadian rhythm. Gut microbiota also follows a circadian rhythmicity and normal sleep pattern, help maintain a healthy microbial balance in the intestine. The sleep-wake cycle synchronizes GI physiology and maintains the digestive homeostasis. Circadian misalignment can impair the GI motility and digestion. It is mostly seen in persons having irregular sleep patterns or schedules. Circadian rhythm disturbance is associated with GI disorders like IBS, GERD, etc. Next slide.
Your time is up.
Next slide, please. Discussion. Nidra acts as a media in maintaining the balance between the Sharira and Manas. Most of the diseases in present condition are mostly influenced by the improper sleeping habits. Excessive exposure to screen, noise and artificial light and irregular sensory stimulation represent a clear form of Asatmendriyartha Sanyoga. Irregular sleep exposure, irregular exposure to light, sound and digital stimuli disturbs the biological rhythm, which parallels with the Ayurvedic concept of Asatmendriyartha Sanyoga. Ayurveda emphasizes controlled and appropriate use of sensory organs to maintain the mental calmness and healthy sleep cycles. Next slide. The practices that person can suggest or adopt is Abhyanga, Utsadana, Snana, Akshitarpana, Karna Purana, Guru Ahara Sevana, Jivaniya Gana Sadhita Shruta or Kshira plus Krita, Sukhashiyasana and Mano Anukula Vishayas should be pursued. Next slide. Next slide. Conclusion. Nidra is a fundamental regulator of physical, mental and metabolic balance in the body. Asatmendriyartha Sanyoga represent an important life-related disturbances, especially in the modern era of excessive sensory stimulation. Adopting sensory discipline and balanced lifestyle practices can restore healthy sleep pattern and prevent diseases. Thus, understanding Nidra disturbances through the concept of Asatmendriyartha Sanyoga offers a holistic Ayurvedic approach to maintaining modern lifestyle disorders. Thank you. These are the references. Next slide. Thank you.
Ma'am, the time taken is 6 minutes and 42 seconds. We are open for the discussion, ma'am.
Pratibha.
Good evening, ma'am. Yes, ma'am.
The content what you have taken, it is a broader way. You should have stripped down to the time, because time also plays a very important role in the presentation.
Yes, ma'am. I'll note it down, ma'am.
When it is 5 minutes means either 5 minutes above that is okay. These things happens when you take so much content to explain. So when next time you're doing, see that your topic, title, content, everything stick on to the time stipulation.
Yes, I'll make sure it.
You can take the thing, you can explain it in broader way, but your things, whatever you have taken as a title or a topic, is a good one, but it is not the platform, or it is not the, because you have a time limit. In that restricted period, you cannot elaborately explain everything. Again, it becomes Tantra Dosha only. How much is needed? Where it is needed? That should be always kept in the mind. Okay? Done.
I agree with ma'am's suggestions. actually, because since it is a very wide topic, you could have restricted to with respect to special eye strain disorders or any special topic you could have limited it.
I'll make sure it the next time. Definitely.
Deepa ma'am, can we go next?
Yes, ma'am. Next.
Dr. Harshita, please
Yes,
ask the
ma'am.
presenters to stick on to the time.
Yes, ma'am. Okay, ma'am.
Okay, please. Thank you.
I request all the delegates to kindly wind your presentation within the stipulated time, that is 5 minutes. There is a warning bell given 30 seconds prior. So kindly take care that your presentation would be winded up within the time. So moving on to the next participant, we have Dr. Nafisa Banu. Your time starts now. You may proceed with the presentation.
Shri Gurubhyo Namaha. Good evening, respected judges. I am Nafisa, third phase BMS from SHAMBHASA, Koppal. Today I am presenting a clinical case report on a evidence of Dadra Kushnam. Next slide, ma'am. This case is about a 50 years old female patient from Karwar, presents with elevated round black patches over the thigh, lower part of lower limb, severe itching over the affected region that get worsened at the around 2 a.m. after coming back from home school. Spots bleeding on the lesions spotted due to the over scratching. Next slide, ma'am. Presenting complaint. The female patient aged 56 years was apparently normal before 3 years ago. Has mentioned the above symptoms. She consulted our hospital for further treatment. She took allopathic medicine. She didn't got relief. So then she consulted our hospital. Next month. Purva Vyadhi Vrittanta. She is not a known case of diabetes mellitus and she is known case of hypertension since 2 months. Aturacharya, personal appetite good and diet mixed, sleep undisturbed, micturition is regular, bowel irregular and habit 2 times tea taken, ma'am. Next slide, ma'am. Her Dashavida Parikshas like Prakriti Kafavata, Vikruti Hetu, and it is Balavan dosha. Dusha is a Rasa Rakta Mamsatva. Prakriti was blackish, elevated, patches and itching all over the body, especially in the back, neck and lower limbs. Desha was Jangala, Kala at night, and then after the sun exposure. Ashtasana Pariksha, Nadi 7. Next slide, ma'am. Systemic examination, not a significant abnormalities. On local examination, skin appendages, multiple slightly erythematous on blackish, well demarcated patches with a slightly elevated borders, itching severe at night, odor nothing specific, color blackish lesion, loss of sensation is absent, ma'am. Next slide. Nidana, she is consuming the Kshira, Dadi, Kulatta, Masha, and then Matsya, Mamsa, Navanna, Vihara like Divasapna, Ati Krodha, taking cold shower immediately after the returning home from the school. Her Samprapti, due to the Nidana Sevana, Tridosha gets aggravated. This vitiated the doshas and affecting the Tok Rakta Mamsa, leading to the Kushta manifestation. Rupa, Kandu, Daha, Krishna Pidika and then Mandala Kruti. On Upashaya and Anupashaya. Upashaya was topical applications. Anupashaya, the itching get aggravated during the night after prolonged exposure of a sun and cold shower after the sun exposure. Intake to fish and red meat and oily foods. Next slide, ma'am. Has mentioned the above Rupa, the Sakandu Dadra Kushnam, Sakandu Raga Pidakam Dadru Mandalam Udgatam, Charaka Chikitsa 7th chapter, Chikitsavad Vatuttareshu Sarpi Romanam, Shleshmuttareshu Kushteshu, Pittuttareshu Mokshaha, Raktasya Virechanam Chagre, has mentioned the Chikitsa. Next slide, ma'am. We conducted Shodhana, Utsadana with Trifala Churna plus Nimbataila for 4 days, Sarvanga Parisheka with Trifala Kashaya for 4 days, Anvasana Basti, Gugulu Tikta Grita for 4 days, Snehapana, we planned Virechana, Trivut Trivrut Leha, Sneha Panalik, Gugulu Tiktaka Grita for 4 days, Vegas for 9. It is an Avara Shuddhi. On Shamana Chikitsa, Panchakola Panta before food. On discharge, Aragyavardhini Vati, Aragvadadi Kashaya, Siddhartha Kasnana Churna, and Bruhat Dantafala Thailam. On external application. Next slide now. We advised Patya and Apatya also. Patya Shali, Tiktarasa Shaka, and Jawar, Yava, Pittergard, and Moringa, Green Grams Mudga, Haridra, and wear clean the dry cloths, maintain the personal hygiene. Apatya like an oily, salty food, curds and fermented food, sweet ice cream should be avoided. Next one. Next slide, ma'am. Before it was in lesions are demarked, ma'am. But after she took treatment, she is noticing some relief, ma'am. Thank you.
Thank you, Dr. Nafisa. The time taken is 4 minutes and 55 seconds, ma'am. We are open for the discussion.
Can you show our first slide, Dr. Harshita?
Yes, ma'am. Just a minute, ma'am.
What was your case, Nafisa?
Ma'am, on the Dadra Kushnam, ma'am.
It is a single arm study or
Ma'am,
single case study, or you have seen
yes,
another
ma'am.
case?
Single case study, ma'am. She is a relative, ma'am.
Which dosha is involved here?
Ma'am, Dadra Kushnam, Pitta and Kapha, ma'am. Her Prakriti was Kapha and Vata, ma'am.
What are the ingredients of Siddhartha Churna? You're final year scholar, right?
Yes, ma'am.
Okay. Final year fresh student or senior student? Huh?
Fresher, ma'am. Fresher, ma'am.
Fresh
Third
student.
experience.
Fresher.
Yes, ma'am. Yes, ma'am.
Have you seen the patient?
Yes, ma'am.
You have seen a patient. Okay.
Yes,
Along
ma'am.
with the patient, even you have seen the medicine. What all are the patient were taking?
Yes, ma'am. I saw only the.
What all are the medicine you have seen from the patient?
Yes, ma'am. Triphala Churna, Nimba, Taila, Gugulu Tiktaka Grita, ma'am. Trivrut Leha. But ingredients.
Siddhartha Kasnan Chode has not seen.
Yes, ma'am. Madanaphala.
It was not available with patient or you have not seen?
Ma'am, on phone call, ma'am. But I know some ingredients, ma'am. Madanaphala, Triphala, Aragvada, and Daru Haritra.
What type of Shodhana can be given here?
Virechana, ma'am.
Virechana.
Yes, ma'am.
Which type of Virechana you get?
Classical
classical method? Classical Shodhana?
Yes, ma'am. Classical method. No?
How many Vegas the patient had got? 9 Vegas?
Ma'am. Yes, ma'am.
Then what is your next line of treatment? Okay, you have given the Shamana Chikitsa and you said patient. What is your next follow-up for a patient?
Ma'am, I asked her to take Vamanam first before Virechana. I asked her to take, ma'am, but she didn't obey, ma'am. That's why we planned Virechana, ma'am.
You told her the consultant also?
Ma'am.
Consultant have suggested?
Yes, ma'am.
Who is the consultant of this patient?
Consulted, Manjula, ma'am. Consulted, ma'am. Yes, ma'am.
Then you have given a proper guidance to this patient?
Yes, ma'am.
If you take only this type of a result, only you will get. All these things have been explained to a patient?
Yes, ma'am, I explained, ma'am, but in Kushta, Sushita Acharya mentioned that repeated Shodhana is indicated, no, ma'am. That's why we are.
That's the reason I'm asking when you told the patient for a follow-up then. What is the second follow-up? This is the first follow-up. This is the first treatment you have put, right?
Yes, ma'am.
After how many days you have told for the patient for the follow-up?
Next 2
months.
3 months, ma'am.
After 3 months?
No, ma'am. After Virechana, she got nervous, it seems, ma'am. She didn't approach it, ma'am. That's why. She said, like, I am, my symptoms was reduced only. So.
उनको डर रहे तो ऐसे ही बोल देते हैं पेशेंट, मेरे सिम्टम्स कम हो गए बोलते हैं, नहीं तो अगली बार आने के लिए बोलती हूँ आप लोग। पेशेंट को आने नहीं रखते
वो विरेचना अवसर करके ही डर गए मैम, इसलिए बट कंसल्ट किए मैम, पूरा ऐसा रहता प्रोसीजर बोलने के बावजूद भी वो ऐसे ही गेट कर रहे हैं।
It's okay, it's okay. Right. You are not so much this one that you are in the first, third year, for sure.
Yes.
It's okay. No issue. Right. From my side over, Dr. Harshita.
Okay, ma'am. Dr. Deepa ma'am and Dr. Agnihotri sir.
Oh, ma'am, nothing.
Okay, ma'am. Thank you, Dr. Nafisa.
Thank you, ma'am.
We have our next participant, Dr. Revati Saboji.
Yes, ma'am.
Just a minute, the slide will be visible.
It's not visible, ma'am.
No, it is not visible yet.
No, ma'am.
Yes, Dr. Aishwarya. Sorry, Dr. Revati, you can proceed.
Okay. Can I start, ma'am?
Yes, you can proceed.
Sure. Om Shri Gurubhyo Namaha. Om Shri Dhanvantariyaye Namaha. Myself, Dr. Revati, first year PG scholar, Department of Rashastra and Vaishajya Kalpana. My second topic is role of Kokutanda Tvak Basma and Nirgulaila Matra Basti in Rajonivrati Chane Katishula with special reference to Savita. Slide. Index, next one. Next one, ma'am. Introduction. According to Ayurveda, the body is formed of 3 functional units, that is dosha,
If imbalance of these three diseases occurs, treatment may be in the either Shodhana and Shamana Chikitsa. According to Ayurveda, Katishula affects the Madhyama Roga Marga as it involves Marma, Asti and Sandhi. The predominant pathological factor for this disease is a Vata. As Shushuta mentioned that menopause deals with the Jarapaka of the body. The insect Acharya as it is a physical.
Dr. Revati, your voice is breaking. Could you please rectify? The timer is paused.
Okay, ma'am. Can I order now? Hello?
Yes, it is audible. You may proceed.
At about 50 years, due to Vata predominance and Dhatu Kshaya. Next slide. Rajunivritti Janya Katishula. Rajunivritti is referred to or correlated to menopause. It is not considered as a disease, but it is a natural phase and associated with aging. So here in